House Leader of Third Party.
Thank you, Mr. Speaker. Relying on agency nursing, private nursing agencies is costing British Columbians and contributing to worsening health outcomes. Spending on agency nursing has steadily increased. 2018, 8.7 million, 2019, 19.9 million. In 2029, that ballooned to $64 million, Mr. Speaker. Those agencies charge a premium and pocket the profit. Meanwhile, the nurses they work alongside are working for lower pay and increasingly unsafe working conditions. Why are the BC taxpayers paying for corporate profits in nursing in the public health care setting? It's unnecessary and leads to worse health outcomes. We need to break this unsustainable cycle. We need to improve conditions for public nurses, and we need public money to support frontline healthcare workers instead of corporate profits. My question is to the Minister of Health. Will he commit to ending reliance on agency nurses in British Columbia?
Minister of Health.
Well, thank you very much, Honourable Speaker. More than a year ago now, we froze our agency nursing contracts. We're currently renegotiating those contracts. We'll have new contracts in place on May 31st, which will have very significant limits on agency nurses. That said, when we need nurses in the community, and we've had this discussion the last few days, we take steps to get nurses in the community. But what have we done? We've brought in a world-leading nurse ratio program with the BCNU to recruit and make this the best place in the world to be a nurse. We've dramatically increased the number of nursing spaces across British Columbia, 604 spaces. We had a record year of new nurses in BC last year. We're continuing, Honourable Speaker, at every level, internationally educated nurses, a 50% increase in the employed student nursing program. In short, Honourable Speaker, we are doing the work necessary to recruit, retain, and attract new nurses in BC. That's critical work for our healthcare system. We're continuing to do that because, and the key part of our work with the BCNU was to address this very issue of agency nursing, to do it together by making this a better place to be a nurse and making it a better deal to be a nurse in the public healthcare system.
Member supplemental.
Thank the Minister for the response. While our failing healthcare system is increasingly propped up by more expensive agency nurses, and we just heard the Minister's moving away from them, student nurses are struggling. Student nurses work hundreds of hours in unpaid practicums through the employed student nursing program. They have to pay to work, they have to pay for parking if they can find it at all, and they have to pay for application and licensing fees. Why is anybody paying for parking at hospitals? Anyway, when those nursing students graduate, they're often deployed into units with the highest staffing challenges and thrown into incredibly challenging conditions. And despite instructions to health authorities to implement greater restrictions for the new grad program, my question again is to the Minister of Health. Beyond student loan forgiveness, how is the Minister compensating student nurses for the hundreds of free hours that they're serving our communities?
Minister of Health.
Honourable Speaker, we had this discussion in estimates. We go through the very significant supports we're putting in place for student nurses, including new seats and other supports. One of the main ways we're doing that, though, is dramatically increasing the employed student nursing program, which is absolutely a paid program. 1,300 to 2,000 spaces, and they are full. And that is part of a continuing effort, Honourable Speaker, to support nursing in our province, to support nurses in our province. When you ask what are we doing for student nurses, that's exactly what we should be doing, which is significantly expanding opportunities through the employed student nursing program to do that. And that was part of work we did with the BC Nurses Union, with the Nursing Bargaining Association, and with the community of nurses in BC, including the universities. I think it's an important step worthy of support by everybody in the House.